Hello, Albert. My name is Tim. I'm your nurse practitioner today. I consulted with the physician that's on call, and together we feel as though that adding a medication called metoprolol to control your overall blood pressure will help. This medication, along with watching your diet, your salt intake, and exercise, will help prevent you from having a higher blood pressure. All these things together will help you overall. Okay, this medication is a beta blocker. It works by controlling the contractility of your heart, by controlling the conduction and the contractility of the heart. It can thus for slow down your heart rate. Okay, it can also lower your blood pressure by slowing your heart rate down, giving your heart more blood and oxygen to the heart. Okay, we normally prescribe this for patients with hypertension, patients that have had heart disease in the past, patients that have had heart attacks, some patients that have AFib or A-flutter type rhythms, but mostly for hypertension reasons. Okay. How does this all come about is that we want to be able to control your blood pressure so your heart doesn't have to work as hard. Okay. Having a serious heart problem or respiratory problem, this medication would be contraindicated. But since you don't have any COPD, asthma, sleep apnea, any other respiratory issues, or heart disease, heart failure, or any heart attacks in a previous, thus far, we're going to go ahead and order this. It will be an oral medication. It will be like 25 milligrams PO. That means taken orally, and you will take this once a day. If at any chance you forget to take a medicine, please don't double up. Please take the next dose when the next dose is required. Okay. This does have some side effects to it. If you feel, because this medication lowers your heart rate, you may feel lightheaded, you may feel dizzy, you may have feelings of weakness, you may have some shortness of breath. It does have a side effect of some confusion. So if you experience any of these symptoms with this medication, please notify your provider as soon as your healthcare provider as soon as possible. You may gain some weight, some water weight. If you're starting to gain more than 2 to 5 pounds in a week, please notify the healthcare provider as well. I'd like you to check your blood pressure twice a day. I would like you to write it down, have a log to where you can write it down. I'd also like you to take your weight every day. And if you notice a trend of you gaining weight, please notify the healthcare physician as soon as possible. This medication will work with the treatment of watching your diet, watching your salt intake, and watching your overall exercise. Okay? Do you have any questions at this time? You don't? Okay, thank you so very much.